Just say also, our statistics show that 50% of neurosurgeons are sued annually. 125,000 medical malpractice lawsuits in America. 75% have no award whatsoever. Doctors in court win 83% of their cases. They win, but the cost of a win is $94,000 each just to win. Well, who pays that cost? We do, absolutely. Sir, over here.
Good morning, Congressman. My question goes to the issue in your particular bill, if it addresses it, the issue of mental health parity in terms of coverage. As you know, I believe, mental health is treated differently than physical medical conditions, where coverage is much more limited, benefits are capitated, they're capitated on a lifetime basis, and as a consequence, mental health coverage is not provided at the same level as physical medical coverage. And that has cascading downstream effects on our society. It affects crime, it affects education, it affects the economy with regard to people's ability to be able to earn income, and it impacts families. And it has never been a situation that's been effectively addressed that I'm aware of on a state-by-state basis anymore. And I was just curious if your bill addresses that issue.
We do. I believe that medical care should not stop from the neck up. Therefore, I've always voted for mental health parity to make sure that that's part of any reform.
I live on my Social Security retirement, but when I went to make an appointment to see my doctor, under that she said, "Are you on any prescriptions or do you have any medical problems?" And she said, "If you don't, you have to pay for your annual physical," which I think is ridiculous because we should be practicing some defensive health care. If we do preventative annual checkups, I mean, how many problems can we catch when they're little versus when they get out of control and you've suddenly got a major cancer problem or something that could have been handled much easier and much cheaper in the beginning.
That's why I'm particularly happy that when we reformed Medicare 4 years ago, we included a welcome to Medicare physical exam to make sure that we catch problems early. I'm also worried about all of this action to stop medical imaging in these bills because an MRI can catch cancer, for example, very early on and lead to tremendous opportunities for success. Some of you may have seen this report that was running this weekend about a number of Canadians who were denied MRI services. MRIs are dramatically restricted in Canada. And so they were told, come back in 6 months to a year. And one poignant story, the man said, "I refused to do that," and immediately went to the United States and paid cash. And my neuroblastoma was cured. And one of my friends obeyed the rules of Canada Health and died. And I think that's too bad. Now, right there, next to Sean. Then we'll go to you, Sean.
Hi, I'm currently in the health profession. And I know we have an epidemic of childhood obesity and diabetes. I was wondering what we're doing for health promotion, wellness programs to prevent these. Because down the line, this is what is actually we're paying for these people with high cost of insurance and health care and doctor visits. And especially in the emergency room when they're coming in with high blood sugars that are out of control.
I think we just touched on 3 things, but there is overwhelming bipartisan support for reform. We are against the pre-existing condition rule. We are for mental health parity, and we stand with the president on looking at obesity and reducing it because Americans, on average, are far more overweight than other countries. And their health costs are higher, and their health status is lower because of being overweight. And so these are 3 areas where my guess is between 80 to 90% of Americans completely support moving reforms in this direction. And if we built a bipartisan bill, those would be in the legislation. Sean, pick somebody back there. Right.
Good morning. You talked about competition, but I think part of competition includes the consumer. And with the insurance program that we've had over the past 40, 50 years, the consumer's out of the equation altogether. We don't call our doctor and say, what is that going to cost? Or we don't check out, maybe the highest priced hospital doesn't have the best outcomes. And I think that should be an important part of whatever reform we have.
I totally agree with you. I think there are two key reforms. I want to make sure over time that you have the right to give whatever you want tax deferred to your health savings account. There you go. I'm concerned because in the Baucus bill, there is a new $2,500 tax on every health savings account in America. Now, we have 500,000 citizens of Illinois who already have a health savings account. And the ability to build up that balance to cover your deductibles, or then if your health status is good, when you reach age 65, to roll the balance of the health savings account into your retirement plan, is an essential aspect of economic freedom in your older years. Also, I am very much for having hospitals all publicly report their outcomes, and so that you can go on the web. One of the leading programs is in one of our hospitals here, and Bruce Crowder led this effort at Arlington Heights, for Northwest Community Hospital, where you can see all of their health outcomes, and it actually makes it easy. You don't have to know what a good number is and a bad number is. They actually coded green, yellow, red, and I think it's not only does it tell us who's providing good cardiac care, who's providing good diabetes care, it's also a signal to the hospital staff. You failed on this point. We have to go back and improve our quality, because otherwise this is going to be published on our next report, and we shouldn't allow that. Every hospital in America should have those outcomes published in clearly understandable form, so that patients looking at, should I go to Lake Forest, should I go to Evanston, should I go to Northwest, can make those comparisons. Sean, go ahead.
Good morning, Congressman.
Good morning.
In my opinion, the public option is the road to the single payer, which unquestionably is the road to socialized medicine in America. What I hear that in the absence of the public option, there's a great deal of talk about co-ops. And my question is twofold. Can you give me a definition of what the co-ops are? And secondly, why wouldn't the co-ops be a slower road to socialized medicine?
We all were interested in co-ops when they were first proposed, but this underscores the need to read the details and to have the legislation before you. In the Baucus draft, we actually don't have the bill, but we have his outline. He uses the word co-op, but it's capital C-O-O-P. It's not actually the English language word. It stands for an acronym, and forgive me, I forgot what the acronym stands for. And then when you look at the details, this C-O-O-P, all capital letters, is government initiated, government subsidized, government run. And so I lead you to make your conclusions.